Here's a segment from the latest edition of St. Charles Parish Today, a monthly local talk show.
The need for cardiology services in St. Charles Parish has grown each year for the past 5 years. And as demand continues to increase, officials at St. Charles Parish Hospital say they have worked to expand access and meet the needs of local patients. Currently, the hospital has a cath lab, full diagnostic capabilities, and a cardiac rehab program, and they recently hired a new cardiologist. Here with me today to provide an update is Chief Executive Officer Austin Reeder and Dr. William Bennett. Well, thank you guys for coming on the show. Welcome. Thanks, Austin, for coming back.
Yeah.
Okay, Dr. Bennett, you started working with the hospital pretty recently, so can you just give us some information on your background and what you're hoping to bring?
Thanks so much for having us today. So I'm originally from Birmingham, Alabama, so not too far away. I grew up in Birmingham, not far at all. Educated in the public school system, and it's a great public school system here in the parish as well. I did my undergraduate work at the University of Alabama, and then I did medical school. I did a combined MD, PhD program at the University of Alabama in Birmingham. And my research interest was insulin-regulated gene expression, which really piqued my interest in diabetes-induced heart disease and effects on the vascular endothelium, and really drove my desire to become a cardiologist. From there, I came to LSU New Orleans for my training in internal medicine. I stayed on a year extra as chief resident and had the pleasure of doing that. Then I went out to the West Coast to Stanford University and did fellowships in cardiology and vascular medicine. From there, I went to Yale for the last part of my training on the East Coast. Did advanced.
It's been everywhere.
That's all over. I did advanced training there in interventional cardiology, focusing on both coronary and peripheral vascular interventions. Then I came here back to the South and took a job with Ochsner, and started here with Ochsner, and I've been there ever since. Started out in Slidell, and then I was asked to join the great team here at St. Parish Hospital and head up cardiology services here. So it's great to be here.
And so you're the head of cardiology services now in St. Charles Parish Hospital.
Yes.
That's okay. So that's what we can expect to see. So cardiology, Austin, has been, as you had mentioned an email, a big thing in the St. Charles Parish Hospital for the past 5 years. Can you kind of give me the history of that?
Yeah,
and where
sure.
we're at now?
Yeah, no, it has. And our program at St. Charles Parish Hospital began 5 years ago. With a partnership with Cardiovascular Institute of the South, which is a group out of Houma. And over the past 5 years, the program has grown leaps and bounds year over year to the point to where we need to be able to grow with it so that we can keep patients local and not have to have patients go into Metairie, Kenner, New Orleans to seek care. For instance, our cath lab procedures in 2017 were over 1,000, which was a 25% increase over prior year. And so we needed to look to say, how do we create access so that we can keep patients local? And so we've brought in Dr. Bennett and the Ochsner River Region Cardiology Group, which is a group of 5 cardiologists, with Dr. Bennett being our primary cardiologist, to continue to grow services for cardiovascular care here in St. Charles Parish.
Awesome. Well, there were some changes in March regarding the cath lab procedures.
Yes.
And can you just expand upon that, or either one of you, and what that means for patient care?
Yeah, and so just a little bit more history. So with the relationship with CIS and the way that the partnership was structured, there was an exclusivity with the cath lab. And so only CIS physicians were able to use the cath lab. And so in order for us to grow, we needed to be able to expand that access to other cardiologists so that we can get more patients in.
Okay.
So effective March 1st, that exclusivity is no longer there, which allows other physicians who are on, other cardiologists who are on our medical staff to be able to use the cath lab.
Okay. So since coming on, you haven't been there too long, but what have you noticed in terms of cardiovascular disease, and who is it affecting?
Well, first of all, this is an incredible patient population that we have here. The patients are so appreciative of the care that you provide, and it really makes a big difference in taking care of patients. What I've seen here so far in my short tenure is cardiovascular disease all across the tables. There's no discrimination in terms of ethnic backgrounds, age groups, socioeconomic groups.
Okay.
People that have higher incomes, lower incomes. Cardiovascular disease is affecting all of these people. And what seems to be common denominators here are the risk factors of cardiovascular disease that are here and so prevalent in the community. Specifically diabetes. 11% of the population in Louisiana have diabetes. Also,
I believe it.
Obesity. 34% of the population in Louisiana is obese. very sedentary lifestyle, smoking, large percentage of patients here smoke. And so all these common denominator risk factors are leading to advanced stages of cardiovascular disease. And I'm seeing this in forms of heart disease, blockages, heart failure, and the full gamut of cardiovascular disease here.
I think just from those things I could guess the answer to my next question. But what type of preventative care, because I read your bio and I know you're big on preventative care, what type of preventative care would you say or recommend to people?
Well, I think the first step in preventative care is really educating the patient about the disease process that they're facing. And by doing so, educating the patient, not only the patient, but the patient and their families, it allows them both to become active participants in their health care. And in terms of preventative measures, really targeting all of these risk factors I talked about: smoking, obesity, eating a healthy diet and lifestyle, becoming more active, exercising, and having at least yearly cardiovascular evaluations by the physicians, making the primary care physicians, which are such a vital part of the role for taking care of patients on the front lines, because they're seeing the patients first, doing screenings every year and getting them over to the cardiologist for advanced care. I think those preventative measures are very, very important.
Oh, absolutely. We've even been doing that internally with Oxnard for our employees.
We have. It's going great.
The hospital always has, I think, like 100,000 things going on.
Yeah.
Is there anything else big going on that you want to let us know about?
Sure. It's been just an exciting year, 2017, and moving into 2018. 2017 was very much a transformational year for us at the hospital. Specifically at Plantation View, we continue to look for new ways to create access to care on both sides of the river. And so knowing that the Mississippi River is a barrier here
it is.
in the parish, and so we
You probably didn't see that one coming.
so we intentionally are looking to see how do we distribute services on both sides. So in 2017, we added a few new tenants to Plantation View. We added Addiction Recovery Resources, which is a regional addiction recovery company, and they're doing outpatient addiction recovery. I know that they partner with the parish and the drug court as well, so we're happy to have them in the building. The Honeydew Coffee Shop opened in the past few months.
I didn't see that. Okay.
Yes, so
I actually just visited the urgent care the other day with a family
Awesome.
member, and it is so nice.
Well, next time you should stop by for a cup of coffee
Well,
and a parfait.
I was preoccupied at the moment.
But then you can go see Dr. Bennett, right? So we're good.
Right.
But also Apache, which isn't a healthcare company, is utilizing the third floor. They're an organization that supports the industry. But in the next few months, we will be announcing some new things for PVMO, one large tenant to be able to take up a large portion of the vacant space that we have. Right now we're about 70% leased for the building, so we continue to work toward filling the building up.
Well, awesome.
But from a hospital perspective, 2018 has already started fast. We've added Dr. Bennett, we've added an orthopedic surgeon, Dr. Howard Hirsch, and I'm proud to announce that we have hired a new GI physician, Dr. Daumau, out of Thibodeau. So she'll be starting with us in the next few months. So continuing to add services, and because of that, we've seen record volumes across the board in the hospital. We continue to move the needle from a quality perspective and also patient satisfaction. So we use Press Ganey, which is a national survey that looks at our inpatient stays, our admission, our ED visits, as well as our clinic visits, and sends a survey to all of those patients. And in all three areas, we rank nationally at the 69th percentile. And then from a quality perspective, we recently got moved from a 3-star with CMS, 3 out of 5, to a 4-star.
Oh, that's awesome.
Which is really competitive with all of the other hospitals in our region. So it's great to be able to offer high quality of care with a personal touch close to home.
Yeah. And then, of course, flu season. You guys have
Yes.
been busy with that, so
Yeah.
it's not as if you haven't had to deal with epidemics.
That's right. That's right.
Well,
So,
thank you guys so much for coming on.
Thank you for having us.
Yeah, thank you very much.
Look for the entire episode at www.scptoday.com or on SCP TV.